apologize in advance that my comments are not more organized.
This is Brent Fields.
So my background, I'm a former hospital administrator. I was a national vice president for a research and health organization. In one of my many former roles, I managed staff whose job was to work in a coordinated fashion with the Department of Health, Texas Hospital Association, Texas Medical Association, and we were very involved in creating, facilitating, coordinating, and launching a number of very complex programs. So I just say that to say, and my wife is a clinician who's managed in a rehab setting, a small clinic, and has run her own practice. So in addition to being parents of a child with special needs, we know a little bit about navigating the healthcare landscape. And as someone with 30 years of executive leadership experience, I'm currently the CEO of an organization here in Austin. I know a little bit about change management, about overseeing large, complex programs, and so I feel for everything that you're dealing with. And I would say, before I offer my comments, I'm an optimist, so I don't assume there's any bad people in this room. I think we're all good people who are smart and committed to doing what's right for the lives in Texas. But I just want to offer a perspective that shows there might be an opportunity that could be missed even with good intentions. So when it comes to cost efficiencies, expense reduction, even managed care itself, I've worked in that landscape, I get it. But I think it's very possible to not get some things out. One of my favorite examples, in one of my roles in healthcare, I had oversight of our orthopedic division. And we very proudly built a new surgery suite one year. And we held meetings with our orthopods and the nurses and everyone involved in that part of the service delivery, and we created what we thought was a state-of-the-art surgery suite. And we cut the ribbon and introduced it to all that staff. And one of the orthopedic surgeons looked me right in the eye with disdain and said, "Where's the casting room?" And I went, "Duh, we missed that." Well, that was embarrassing, and I apologize, but you know what? No one died, no homes were broken. We called the contractors, we spent some money, and we built the casting room. So my point is, I think you're all good people who are listening and caring, but I think if we make a mistake with this, it's not a casting room. And I don't say this to try to sound dramatic. I told my wife the other night, I hope I'm wrong, but I worry that I'm going to see on this Facebook group the announcement of a funeral. And I know with my daughter, we have access to some of the best care in the world. But what often is critical between life and death for her is processes. So even if I have the greatest insurance and the greatest physicians and the greatest ER protocol, if that process doesn't work in a timely fashion, it's life or death, and no one intends for that. But that process is that critical. So I guess my last comment would just be also, and I think you are, but I just have the utmost respect for the people behind me. And between the parking garage and this room, I overheard the following comments from people walking near me. "Yeah, there's a lot of unhappy moms going to be in that room today. Well, you know how it is. Everybody hates change. Yeah, they just don't understand. I'm glad I'm not working on that project and having to deal with them." Now, I don't think those are bad people either, but I think it's symptomatic of, even with the best intentions and the most listening, you can miss some things. My very best friend when I was a hospital administrator had a son with spina bifida. And I swear to you, until I had a child with special needs, I had no clue. I was a hospital administrator. I have 3 degrees. I should know a lot about that, and yet until I walked in those shoes, I had no clue how those processes drove critical pathways every day. So, thank you for listening.